Here with Patrick and Greg. We're working on Greg's upper right scapulae. Right about in this area would be where his teres major and teres minor musculature attaches. We got a little hardness here, so you can see my hands are just like a magnet. They're being held here, and that's just sort of like well, how can I explain it? Like the planets rotating around the sun, the gravitational pull. And it's a similar concept at work here. We're working with laws of opposites, positive, negative charges. But on top of that, as I mentioned earlier, we've got some hard tissue. So you want to wait, pause. In fact, the body will do that for you. If you pay attention to it and allow it to guide you, it will hold you there until she releases. So, probably hurts kind of good, huh, Greg?
Yeah.
So, feel kind of sore, but oh my God, good. What he means by that is that it's like kind of like when you scratch your doggy, and you can see him just, oh, get that there. It's kind of like that. That's what this is. Though it might not look like that in the camera, you just have to kind of take my word for it. There's a little acupressure point right here. Right about now it's starting to melt a little bit, so we're going even further into depth in his musculature, soft tissue. And now I'm just sort of guiding that through and pulling that out. So it's like working with taffy. It's like getting gum out of hair. Now I'm just going to go over with my thumb, sort of separate that and smooth that out. And also have our lat musculature that runs up through there. Here we're in the medial side of his scapulae. We're running across the thoracic and cervical vertebrae. I'm sure that feels really good to him, but deep inside we have a group of muscles called the rhomboid. And it's actually in pretty good shape because before we started filming this, we had worked on this for quite a while and softened and released and stretched that out really actually quite nicely. So, but right up in here I can feel a little bit of a hardness or a pull, so we're going to slow it down a little bit, spend some time with that. It might not look like much to the eye of the camera, but all kinds of wonderful changes are going on here. It's just lifting that tissue up, so all of these fascial cells, remember the fascia is the tissue just below the skin, they're separating, so like little sand granules, and then falling down and out. Remember, 70–80% of the human body is water, so we're working with a lot of liquid here. That's our ground substance. So if you think of that, you can see how I'm dipping into a lot of liquid in this musculature to the sides of this spine. Down here, this probably feels really good to Greg too, because this is hardened through here in this lower rib area, so we'll get some of that out. I'm not sure how well the camera's picking that up, but getting right deep inside, and that really feels great. And it will feel great to the individual that's received the work for, if not a few days, sometimes 2 or 3 weeks. It's really quite surprising. At least I still find it quite amazing how far a little bit of body work can go, even with a seasoned athlete like Greg, somebody that is in the gym regularly and plays baseball and coaches and goes to school, and in spite of all of that, you will probably reap the rewards of this for, I would say, 2 to 3 weeks. Not only physically, but mentally, emotionally as well. Remember the mind-body complex. And in these, well, bony, muscular areas of the spine and pelvis and all of that, deep inside are the neuropeptides and all of the other endorphins that you hear so much talk about these days. Best way to really access that, we all heard of the runner's high. This is a much quicker way to get a release of that endorphin, that inner chemistry that's just lying there, sort of waiting for somebody to come along and open it up, you could almost say.